Thank you so much for your interest in becoming a doctor. Now there's one more thing we need to talk about. Are you ready to explore the role of inflammation in cardiovascular disease the right way?
You bet I am. That's so rad. Let's dive right into it.
Great. Well, first things first, we need to define a few terms first. That way, both you and your at-risk patients will be able to adequately understand not only what they are dealing with, but how to prevent it.
Cardiovascular disease refers to a class of disorders that affect the heart and blood vessels, such as coronary artery disease, atherosclerosis, myocardial infarction, also known as a heart attack, and stroke. Cardiovascular disease is the leading cause of death in America, with one person dying from heart problems around every 30 seconds.
As medical professionals, we know the major contributors to cardiovascular disease: high blood pressure, high cholesterol, smoking. But what if we told you that there was a contributor that you may not have thought of as much about that may be the precursor to all other contributors?
Hi there. We are qualified professionals, and we would like to talk to you today about one particular major contributor to cardiovascular disease. Inflammation!
Inflammation is the body's protective mechanism against infection and injury. Inflammation is the immune system's way of telling us, hey, something is wrong here, and implores us to fix it. Recent research has been showing us that inflammation has a direct link to cardiovascular disease by causing damage to the endothelium, or the inner lining of the blood vessels.
Let's take a look at some precursors. Remember, inflammation has its places in cardiovascular disease.
Inflammation plays a central role in the progression from endothelial dysfunction to atherosclerosis, or fatty substances being deposited into the arterial endothelial walls. Triggered by adhesion molecules and chemokines, this cascade leads to the recruitment of inflammatory cells, including monocytes and polymorphonuclear neutrophils, also known as PMNs. As low-density lipoprotein, also known as LDL, deposits and oxidizes, it sets the stage for plaque formation. Over time, this plaque hardens, becoming unstable and prone to rupture. The critical juncture of plaque rupture is pivotal in understanding the gravity of cardiovascular events. Upon rupture, the exposed tissue factor initiates blood coagulation, obstructing blood flow and precipitating severe cardiovascular events like heart attacks or strokes. A blood clot will form and grow, impeding blood flow, and if dislodged, can travel through arteries. Cholesterol management using dietary interventions, lifestyle modifications, and cholesterol-lowering medications will potentially prevent the dire consequences associated with plaque rupture and cardiovascular disease. One such medication is called berberine, a natural supplement used to reduce oxidative stress and lower LDL levels in the body.
We, patients and medical professionals included, know how important our lifestyle choices are to our overall health. This is especially important when considering patients' risk for cardiovascular disease. Some of the most damaging lifestyle factors for cardiovascular disease include poor diet, lack of exercise, stress, obesity, and smoking. Smoking is akin to pouring fuel on the fire, damaging blood vessels and heightening inflammation. Excess visceral fat releases pro-inflammatory interleukins, making it a key contributor to cardiovascular risk. Processed foods act as instigators, intensifying inflammation. Quitting smoking emerges as a direct and impactful intervention, instantly alleviating stress in the heart and diminishing the risk of cardiovascular issues. Dedicating just 20 minutes a day to exercise helps with weight management, but also directly lowers overall inflammation levels. Incorporating omega-3 rich sources like fish, flax seeds, walnuts, or chia seeds become a nutritional ally against inflammation. Changing a patient's lifestyle choices depends solely on them, but it is up to us as medical professionals to convey these straightforward lifestyle messages that could serve as a roadmap for patients, offering tangible ways to manage inflammation and, in turn, reduce the likelihood of cardiovascular complications.
Inflammation is a key player in acute coronary syndrome, also known as ACS, which involves heart conditions like heart attacks and unstable angina. When immune cells in heart arteries trigger inflammation, it can lead to the formation of blood clots, often due to the breakage of fatty deposits in the arteries. Atherosclerosis, a long-term inflammation problem, contributes to the buildup of the fatty deposits in the heart arteries. Understanding how ACS develops and progresses, whether that's with systemic inflammation or without, involves looking at the complex processes in the arteries, like cholesterol buildup and immune cell activity. In the body's response to heart issues, the immune and inflammatory systems are crucial. Changes in the balance between these systems, often influenced by factors like age and lifestyle, contribute to the development of heart events. Treating ACS involves quickly reopening blocked heart arteries, often with surgical procedures like angioplasty. Medications like aspirin and others prevent further clotting, while drugs for blood pressure and cholesterol help the heart work better. In addition to lifestyle changes and cardiac rehabilitation programs, medications such as beta blockers, ACE inhibitors, and statins can manage blood pressure, heart rate, and cholesterol levels to minimize heart damage.
Inflammation orchestrates a complex symphony involving immune cells and an array of cytokines. Monocytes recruited to the site of inflammation differentiate into macrophages, releasing pro-inflammatory cytokines such as interleukins, tumor necrosis factor, TNF, and interferons. T cells play a critical role, activating M1 macrophages that amplify the inflammatory cascade with cytokines like TNF-alpha and beta, IL-1 alpha-beta, IL-6, IFN alpha-gamma, and IL-8. Conversely, T cells also activate M2 macrophages that produce anti-inflammatory cytokines including IL-4 and IL-10, which counterbalance the inflammatory response. This delicate balance between pro-inflammatory forces shapes the trajectory of cardiovascular pathology. Oxidized low-density lipoprotein, LDL, cholesterol adds another layer to this intricate scenario, contributing to the pro-inflammatory environment. Lifestyle modifications, including smoking cessation, weight management, regular exercise, and healthy diet, are pivotal in reducing pro-inflammatory factors. Medications include over-the-counter aspirin and ibuprofen, which block inflammatory messengers. Fish oil is a natural alternative, containing antioxidant and anti-inflammatory properties such as omega-3. For patients allergic to seafood, various nuts and seeds can be a good alternative.
Endothelial dysfunction occurs when the inner lining of blood vessels doesn't work properly. Normally, healthy endothelial cells release nitric oxide, which helps blood vessels relax. In endothelial dysfunction, nitric oxide production is reduced, which causes difficulty in blood vessel relaxation and increased resistance in the blood vessels. Elevated CRP levels may also be seen. This dysfunction also triggers a pro-inflammatory state, meaning there's an increase in molecules that promote inflammation within blood vessel walls, contributing to conditions like atherosclerosis. Endothelial dysfunction can lead to a higher risk of blood clot formation, or thrombosis, potentially resulting in heart attacks or strokes. Lifestyle modifications like regular exercise, maintaining a healthy weight, and a heart-healthy diet will enhance nitric oxide release and improve vascular health. Statins and antioxidants may be prescribed to counteract oxidative stress associated with endothelial dysfunction. Antihypertensive medications will manage blood pressure. Antiplatelet medications and anti-inflammatory approaches play roles in reducing the risk of complications, such as thrombosis, contributing to an overall strategy aimed at restoring and maintaining vascular health.
Systemic inflammation stems from factors like stress, infections, and chronic diseases. This chronic activation of the immune system creates an environment that adversely impacts blood vessels, fostering atherosclerosis. Inflammatory mediators, including cytokines and adhesion molecules, promote the deposition of lipids in arterial walls, increasing the formation of atherosclerotic plaques and weakening plaque stability, making them more prone to rupture. C-reactive protein, also referred to as CRP, acts as a crucial marker of systemic inflammation. During an infection, white blood cells will stimulate the liver to produce CRP, which will trigger a pro-inflammatory cascade. High levels of CRP can be caused by many different lifestyle factors, including age and stress. Managing systemic inflammation through lifestyle modifications, such as maintaining a healthy diet, stress management, and regular exercise, becomes imperative in preventing and addressing cardiovascular disease. Medications, including anti-inflammatory drugs and statins, as well as antioxidant supplements, may be prescribed, and CRP levels are heavily monitored.
Now you are ready to tell your patient. Please keep in mind that a patient at risk of cardiovascular disease or already has cardiovascular disease is experiencing a lot of stress. So please be sure to
tell them professionally and gently.
Thank you for joining us today.
See you next time.